Alrighty, good morning. Welcome to the Town Meeting Program for Wednesday, July 29th. J.R. Lewis with you here on KLAM, and we are glad you could tune in and catch this information from the governor's latest press event, which was held yesterday. And there are some developments regarding the state's response, particularly in the area of incoming travelers from out of state. It's just good to, obviously we focus a lot on what's happening with local response, but we also want to keep up on what's happening at the state level as well, because obviously there have been some pretty significant bloomings of cases, especially in Anchorage, of course, but in other places around the state, places in the fishing industry. Fortunately not us, we seem to be doing it right, but there are other facilities around the state having a lot of trouble. So we'll just kind of, in case you missed the briefing yesterday or didn't hear about it or didn't hear about some of the outcomes, we thought it'd be a good idea to listen to that today. So that's the goal, and we are brought to you on this program, as always, by Cordova Wireless Communications. They are your local cell phone provider and a wireless data provider and provider of your local talk program. So let's dive right in here and listen to yesterday's press conference with Governor Dunleavy and crew regarding state COVID response and mandates, and just kind of get up to date on things.
We have a number of things to go over today. So it's exactly 6 months since Alaska dealt with the flight from Wuhan, China, back in January. And this is the beginning of Alaska's participation, for lack of a better phrase, in this worldwide pandemic. So we've been dealing with this for 6 months. Again, this is not something any of us planned, any of us thought about. You read about these things, you see them in science fiction movies, but here we are. So this is our generation's challenge. It's the best way I can put it. So again, it's been 6 months. We have had, in the state of Alaska, hundreds and hundreds and hundreds of dedicated professionals dedicating 15-hour days, literally 7 days a week in many cases, to try and deal with this virus, to try and understand this virus, to come up with the best protocols, the best approaches to kind of manage this virus. And I say manage this virus because, again, anything short of a vaccination or some type of radical change that changes this virus into something a lot milder, anything short of that, we've got to manage it. We have to incorporate it to an extent in our lives, and we have to manage it on a daily basis. So again, I want to thank everyone. I want to thank all of you Alaskans. We were just talking about this before the cameras came on, that this has been quite a change in our lives. The whole idea of wearing a mask, for example. When you leave your house now, a lot of us are saying, do we have our wallet, do we have our keys, do we have our phone, do we have our mask? A lot of us are doing business distance-wise, on the phone. If we have to meet in person, a lot of us are 6-10 feet apart, or we try and meet outside. A lot of us are really trying to do our part to deal with this virus. And there'll be times that even the best of us come up short. Some of us may forget a mask one day, or they may find themselves in a group in which they thought it might have been outdoors, but they find out that it's indoors, or there's more people in the group, et cetera, et cetera. But I think more and more and more of us are taking on that personal responsibility so that we can do better at trying to prevent us as individuals from getting the virus, and from us spreading the virus as well. And so we're going to keep working on that. Our cases are going up, but I want to talk about it, just the cases in general, before we have Dr. Zink give us some detail. So this week alone, I'm going to illustrate something for some of us if we think Alaska is the only place on the planet that's experiencing an increase in cases. Many of the countries that were touted early on, Asian countries, European countries, right now are experiencing spikes, record numbers in some cases of the virus. Keep in mind, these were countries that early on had shut down, put a lot of mitigation approaches into place, wore masks from the get-go. So, for example, Japan this week hit a high in terms of cases. This is Japan. If you know anything about Japan, prior to this pandemic, a large number of Japanese citizens would wear a mask. It's a result of what happened many, many decades ago in Asia with regard to different types of pandemics or diseases that had impacted Japan and Asia. But nonetheless, Japan is seeing an increase in cases. They're pretty diligent. They're pretty conscientious. Singapore was touted early on, the small city-state of Singapore, as being a model because they had stood up a SARS hotel, a hospital that was put in place during the SARS outbreak years ago, and that they were handling it and mitigating their virus well. Their cases have gone through the roof. Korea, South Korea, was touted early on as well. They're seeing a spike in cases. Australia, in Australia, they have travel bans now between two of their states. First time they've done that in over 100 years because their cases are spiking. We know the story about our states in the lower 48. Doesn't matter if it's a big state, small state. Doesn't matter if it's got a Republican governor or a Democrat governor. We're seeing a rise in the cases. Germany is concerned now. Reports out here the last couple of days that they're concerned about the rise in cases in Germany, another country that is touted as being pretty conscientious with regard to trying to mitigate this virus. In the Czech Republic, for example, on July 1st, there was a sort of a celebration, the end of the pandemic. Just a couple days ago, they've reinstituted a number of mitigating approaches to the virus. So the point is, and I'm not even talking about Africa, that's seeing in the Middle East, that's seeing a rise in the virus. South America, places like Colombia, Brazil, Central America, like Mexico, well, part of North America, Mexico, but also Central America, all are seeing more and more cases. And it's not because they're doing a bad job. It's because this virus is highly, highly infectious. It's easily spread. We've been through this. And so we're starting to see a tightening now of some of our protective equipment. We're starting to see a tightening of some of our testing reagents. And so I'm asking Alaskans, again, that we take the next 3 weeks and do our best to mitigate this virus. Now, some people are going to say, why is that? Because we're going to talk a moment here about the number of cases, but also the hospitalizations, which is very important. Again, I'll be the first to say that initial models that we were presented with showed a lot of sickness, a lot of hospitalizations, and a lot of deaths. And those models which we operated under resulted in us taking actions in Alaska that kept our numbers really, really low. But that came at a price. Came at a price for our economy, came at a price for individual businesses, came at a price for workers, came at a price for our society, our churches, our religious activities, our get-togethers, the way we do business. Came at a price, came at a heavy price. So when we found out that this virus was not as lethal as we thought, which was literally a thank God moment, and as I mentioned before, when it really, we determined with pretty good certainty that it was not going to impact children like other types of viruses like flus do, that was a bit of fantastic news. But nonetheless, what is holding true from those earlier models is the infections. Now, the vast majority of us that are infected, again, we don't know it, or we have mild symptoms, or we have symptoms, and some of us end up going to the hospital. But again, it's the older folks, it's our seniors, and those that have already had underlying health conditions that we really have to be careful about. So I've had a number of conversations here recently. We're constantly working this pandemic and our response in Alaska. And I know there's a lot of folks that are calling for universal approaches to the pandemic, universal masking, shutdowns, travel restrictions, severe travel restrictions. Again, our goal has always been to make sure we don't overwhelm our healthcare system. Our goal is to make sure that our hospitals can deal with the people that are sick, whether it's the coronavirus, whether it's a car accident, cancers, strokes, heart attacks, the things that we deal with in Alaska on a daily basis, the things that this country and this world deals with on a daily basis. And we understand that the hospital systems have refined their system so that they have incorporated over the decades the issues I've just discussed in terms of a seasonal flu, heart attacks, so forth. But what happened with the coronavirus is that's an added layer of sickness on top of these other sicknesses that potentially threaten healthcare systems. And so in Alaska, we're still doing a pretty good job, even though the numbers are climbing. It's concerning, and we're going to talk about that here in a moment. Our death rate is climbing. Today we're 22, but that's still very, very, very low compared to most states. And it's very low compared to how Alaskans, unfortunately, pass away on a daily basis. So what I'm trying to do here is just put things in perspective. It's very important because there's going to be a lot of calls, and there is, for mandates, that we must do this, and all of us must do this now. What we want to do is take a more surgical approach dealing with the virus. Because again, no matter what we do, there will be a cost. It may not be that heavy in some instances, it may be heavy in others. We just have to be careful that we have a balance as we work through this. Folks are very optimistic that we'll have a vaccine that works. Sometime in November is the target for that. Mass production, as I mentioned last time, is anticipated shortly thereafter in December and January. We're going to talk probably in the next presser or two about flu vaccinations that'll be coming out here in the fall, late summer or the fall. And we're going to encourage everyone to get a flu vaccine. Why? Because with this extra layer of this coronavirus, we want to take some pressure off of our healthcare system, take some pressure off of our doctors. And we certainly want to keep people healthy, but we'll talk more about that here in future press conferences on how our approach to the seasonal flu can help us manage this virus better. So again, countries across the world that were heralded as models, good countries, good people, their cases are going up. States across the United States, cases are going up. Doesn't matter if you're in a red state, blue state, big state, small state, cases are going up. Not everywhere, but in many, many states, the cases are going up. And of course, as I mentioned in Europe, same thing has happened. So let me get to the cases for a moment here. We'll talk about some stats, and then I'm going to talk about a couple. I'm going to have a couple slides I want to reference. So our new case count is 110. This brings us a total of 2,729. New deaths is 1, and it's my understanding, and Dr. Zink can talk about this in a moment, but that brings us to total of 22. All of those folks had existing preconditions, and this virus, unfortunately, pushed them over the edge. And again, with any death, our condolences go out to the family and friends of the people that we've lost in Alaska. Cumulative hospitalizations, 120. Total recovered, 836. Total tests, we're still in the top 3 for testing, and that's 213,875 tests. And so we still have some of the best metrics. Our ICU cases remain low, 5, but hospitalizations are creeping up. We're at 34. So again, how do we deal with this? what are we doing right? What are we doing wrong? It's the same question we're being asked, or other locales and states and countries are asking themselves right now. What do we do? It's a continual effort to, again, modulate how we deal with the virus, and we'll talk about some of the things that we're planning on doing. So again, if we can stay away from each other, 6 foot or more, that virus has a very, very difficult time leaping from one person to the next. And as I've said before, if you can have meetings via phone or audio visual, that helps. If you can shop 1 or 2 days a week as opposed to 5, that helps. If you are going to have a get together with your friends, and trust me, we all want to. We all want to enjoy the summer here in Alaska. To the best of our ability, have it outside and spread yourself apart. Funerals and weddings, if those can be conducted outside, that helps. If not, and you have to have them inside, we're going to recommend strongly that you use a mask. Again, it's distance that is our best tool right now, and if we can't have distance, then we wear a mask. If we can have things outside, it's going to help tremendously as opposed to inside. And so these are things that we constantly have to remind ourselves. And we're seeing a bit of a change in the way we deal with folks, with each other. More and more, less folks are shaking hands. More and more folks are distancing themselves. More and more folks, are asking where, one's mask is, and almost inevitably, most people have a mask in their pocket that they pull out. As I joke around with some people, I say the mask is going to work better if it's on you. But nonetheless, we're starting to make some changes, and that's a good thing, because what we want to do here is we want to get our cases kind of stabilized or even pointed down a little bit. It's just going to help us as we go into flu season, and we need those hospital beds. But again, this is not about scaring people. Cases are going up, but we know more about this virus, and we know how to address it on an individual basis. The other thing we're going to talk about is what communities can do. And so what I'm going to do is I'm going to turn to Dr. Zink, let her talk about the cases, the particular cases, and other data that she has, and then we'll go to a couple slides, and I'll talk about what local communities can do, local municipalities, and what authority they have to help us fight this pandemic. So with that, I'll turn it over to Dr. Zink to go through this, the numbers, give us some details, and then we'll go back to a couple of slides that's going to talk about our municipalities.
Great. Appreciate it, Governor. And thank you, Alaska, for tuning in. A couple additional slides and information. So switching to the first slide with the dashboard. Before I get started, I just wanted to let Alaskans know that we will be revamping the dashboard. We're working with our partners this week so that they can get additional information. And by next Tuesday, we should see a change, a pretty significant change that will provide a lot more information to Alaskans, including place of residency as well as occurrence, and a bunch of different ways to toggle through this information. So we're going to be moving to the date of occurrence when the test was done, not when it was reported, so that we can get, again, we're just trying to get most accurate and timely information. In general, Alaska's resident cases rose 34% in the last week. We've had a rapid increase in both resident and non-resident cases, as the governor just previously mentioned. The majority of the cases really do continue to be those in the 20s and 30s, as well as those in the 30s to 40s, and continue to watch that really closely. So as the governor mentioned, just that distancing can make a really big difference. Continues to see bars and gatherings outside and gatherings inside. Again, that distance makes a really big difference. And so particularly for those in their 20s and 30s and 30s and 40s, we're seeing a big driving force in there. Continue to really try to minimize your interactions in close confined quarters so that we can push down these numbers and keep people healthy and moving. Travel does not appear to be the main driver, but it does appear to be a factor, and continue to watch that closely. Hospitals can currently continue to have adequate capacity, and we'll talk a little bit more about that, and can continue to encourage people to avoid large gatherings, particularly indoor gatherings, wearing face coverings whenever possible, particularly when you're near others, and that good hand hygiene, as well as washing frequently touched surfaces. Moving on to the next slide, healthcare capacity. We're looking at both healthcare capacity in the state as well as in the Anchorage rural area, specifically because of the regionalization of our hospital care and capacity. It's important to note that this capacity can be filled from many different things, COVID and non-COVID related, and does need to be staffed, and work closely with our hospitals and hospital association to watch that on a fairly regular basis. Have that updated on the dashboard and continue to get some additional information. Moving on to the next slide regarding public health capacity, this is really kind of that testing and contact tracing. We want to make sure that we're doing at least 2% of the population a month and continue to follow that closely. As the governor mentioned, still have fairly robust testing, even though the turnaround times can be long. We have additional information about that that I can share tonight, and will also be in our new dashboard so people can monitor the turnaround. The testing environment is really important. We continue to see reagent shortages nationwide, and so that's why we're in that orange zone there. It does impact testing across the state, and particularly in some of our rural communities. We are able to get alternatives usually available, but sometimes those take longer, and that's the reason that was in the orange. We see this as a nationwide problem. We continue to work through that process. For our public health lab capacity and the turnaround time, in general, it's about 48 hours for the state turnaround time, and so that's why it's in that orange region. Looking at our contact tracers, again, we're looking at kind of 3 different components. How many people are people in contact with? And are we able to get to most of those people with less than 24 hours? Currently, we're not able to get to the majority of people within 24 hours, and appreciate all of the work that providers are doing to make sure that they are notifying patients right away if they're positive and asking the public to notify their close contacts. We have seen significant progress in our public health capacity along contact tracing, and while we're still able to do it, they have gotten slower, and we're hoping to improve that here shortly. And so with that, I really appreciate everyone's patience and work with this. The more that we can stay 6 feet apart and the more we can wash our hands and wear our masks is just incredibly important. We've seen all sorts of amazing ways people have been resilient. Saw a favorite restaurant recently that's at completely drive-through and find ways to mitigate it. We can find creative ways to do it, but helping to drive down those numbers and to be able to protect each other is going to be critically important in the months to come. So with that, I'll hand it back over.
Thanks, Doc. So we're going to go to a couple slides because we want to talk about what can happen at the local level. So there are several approaches to dealing with this virus. One is international, one is national, one is statewide, and there's also local. There's a local approach as well as individual approaches. We talked a lot about individual approaches. Early on, we talked about what the state had done and what the state still has in place. But we also want to talk about what can happen at the local level. In most of your states, I believe all of your states actually in the lower 48, it's not just the state that has the ability to mitigate, put into place advisories, restrictions, etc. But in the lower 48, counties have this ability and cities have the ability, depending upon if the outbreak is local or if the case numbers are rising in a local manner. And we talked about this, that when we start to open up, we would watch our cases and we would watch our clusters, and we would try and work with folks at the local level to address that. So, for example, what we're seeing now is a rise in cases on the rail belt from Kenai to Anchorage to Matsu to the Fairbanks area. We have a bit of an outbreak that's being, I think, handled down in Juneau as well. And what we're seeing is, as we opened up, we got a couple issues that we're dealing with some of the fish processors that have local workers. Also, we believe the house parties and the get-togethers, for example, are also contributing to the rise. Again, it's mixing of people. And what we want to talk about here for a moment is what local communities can do. Because right now, this is not there are many, most of the communities in the state of Alaska, as we mentioned earlier, have never seen the virus, don't have the virus. And I know there are calls or requests to do statewide mandates that would impact communities that, once again, have never seen the virus. And so what we've done is we've done some work with the Department of Law, and we've worked with a number of, we've had some calls to a number of mayors here the last week to try and to share information, because there were questions as to whether local communities have the ability to go before their councils or their assemblies and put in place restrictions or advisories. And we do have a representative from the Department of Law here that will be able to help answer questions. But the long and short of it is that local municipalities in Alaska, just like most of our states in the lower 48, have that ability. And so on our first slide, I think this is what we're looking at, correct? Our first slide, we have a color-coded slide, and this was put together based upon federal guidelines to offer up suggestions if your community, for example, has a certain number of cases. So high is red. You can see where there's suggestions on face coverings and masks. The social distancing is going to be the same no matter what we do, consistently through whether it's you're in a high zone, a moderate zone, a minimal zone. For those places, most of our communities that have never seen the virus, life can continue as normal. Just have to be careful that something doesn't get in there. And this is why we still support the restrictive travel that some of our communities have on non-essential travel going into our communities. You can see we're in the high, moderate, and minimal. They talk about how to deal with large gatherings. Large gatherings could be anything from, again, house parties, could be conventions or conferences, could be game events or events outside, could be things like fairs, etc. And so large gatherings are something that we need to keep an eye on, because again, if we're 6 feet or more, 6 feet or less, that virus can jump. And then there's discussions on how restaurants and bars and nightclubs could be approached in the different categories of high, moderate, and minimal. We go to the next slide, and it puts into perspective what areas are in red, what areas are in orange, and what areas are currently in yellow. And so this gives an idea of what municipalities or what local areas are going through the different stages. So for example, we know that we have a surge in Anchorage. Cases the last 14 days, 588. Case average the last 14 days, 42. And the case rate is 14.39. But you can see on this slide where your particular area may fall. And so again, the discussion is at the local level. Anchorage has instituted some advisories and restrictions, but other local areas of the state can do the same. And this roadmap, this chart, is going to help people understand where they're at and what some of the mitigating suggestions could be. But again, I think it's really important that this discussion happens at the local level. I'm going to talk here in a moment what the state is going to do in terms of changes with regard to travel into the state of Alaska. And we'll continue to, as I say, modulate this. In other words, again, instead of just doing statewide mandates and statewide restrictions that may impact communities that never will see the virus or never have seen the virus, I think we need to take a targeted approach. And these slides, this roadmap, these charts, help us kind of navigate through that and have that discussion. So one of the things that we're looking at is a change in the way we do travel into the state of Alaska. We are finding that a number of travelers coming in to the state of Alaska, non-residents, are obviously, unbeknownst to them, coming into the state of Alaska with the virus. And so in an effort to try and minimize the number of cases, starting on August 11th, we're going to make a change that all non-residents must arrive with a negative COVID-19 PCR test taken 72 hours prior to arrival. As it stands now, we suggest that happens. We hope that happens, and a number of travelers that come in are actually doing that now. But we've also allowed travelers to come in without one, and that we would test them at the airport. Again, as we see a tightening of our supplies and an effort to reduce the virus coming in, we're going to need those supplies to deal with some of the outbreaks here in the state of Alaska. We will still test residents of Alaska coming and going at the airport if they don't have a test before they leave and when they come back from their destination. We will still treat Alaskan residents the same with regard to that. But testing on August 11th for non-residents will cease. They need to come into the state of Alaska with a negative test. Now, some folks are going to say, this is going to be problematic, this is a burden, they can't get tests. There's no doubt that every aspect of our lives is going to be impacted by this virus, including travel. When the cases were lower than they are today, not just here in the state of Alaska, but across the globe, you had less of a restriction on supplies of testing materials and things like PPE. We need to use that for our own folks. So if you're going to come to Alaska, and this is why we're giving 2 weeks, because we know people have already planned to come up here. We'll test those folks over the next 2 weeks. But on the 11th, you want to make sure you have a negative test. If you go to other countries, for example, they require shots, they require passports and visas, etc. So we're not trying to make this difficult for folks to come here. We just want to make sure that we are taking care of Alaskans first. And then we will be talking about new updates to our approaches to the seafood industry this week. We'll either have another presser or press release on some changes to those protocols as well. So we're going to start to modulate this at the state level. We've demonstrated, and we'll open this up for questions in just a moment, about what local communities can do if they so choose to help modulate it. As we mentioned, Anchorage is going through a few steps in that process now. And together, again, I really believe that if we remind each other, keep distance between us, if we remind each other to put a mask on if we have to go and deal with folks, that distance and the backup of the mask, I believe, is going to level off these cases. And I think we'll actually start to see a downward trend. But the most important thing is it allows us to process those that are infected and those that get ill into our healthcare system without overburdening the healthcare system. And that's what's important. Very confident that a vaccination in November is going to occur. And then again, we'll talk about the flu, the issue of seasonal flu here in a future press conference. So with that, what I would suggest, Jeff, is that we open it for questions. We do have Dr. Zink. We do have Commissioner Crum. We do have Heidi Hedberg, who does our logistics, deals with supplies and logistics. And we do have Attorney Ed Sniffen with our Department of Law to answer any questions regarding the ability of municipalities to elect to have advisories and restrictions if they need to. And we'll answer any questions on the charts and the slides that we presented. So with that.
Okay, thank you, Governor. For the reporters online, we're going to start in Fairbanks tonight, and then we'll go to Anchorage, then Juneau, and then we'll wrap things up in Cordova and the Kenai Peninsula. Let's take our first question from reporter John Doherty at KTVF in Fairbanks.
Yes, thank you so much for the chance to ask a question. I was just wondering, Governor and whoever else is relevant, I know Fairbanks School District last night decided to hold the first part of the semester, at least that part, online, and Anchorage School District has decided similar. Does the state of Alaska have an official position on what they would like to see school districts do, or is that completely up to each school district?
Well, our position is that we want kids to be educated. And what I mean by that is, ideally, they would be in the classrooms. But we also know that there has to be contingency plans if there is a rise in the virus that impacts staff, potentially children. And so the charge that the Commissioner of Education has, and he's on August 4th, we're going to dedicate a large portion of a press conference as well as probably a Facebook Live for the Commissioner to explain what they've been working on over the past couple months with regard to opening of school. Again, what we've learned about this virus is that young kids aren't really impacted by it. But we also know that if we don't have school, that's going to become problematic for our kids. We stopped school in the spring, canceled school in the spring. That's a problem. We did that in response to what we thought was going to be a large infection rate, hospitalization rate, and death rate. We weren't 100% sure at that time what the role children played in this infection. We're learning more and more now. So officially the position is we have to educate our kids. Ideally, we do it in the schools. Our 53 school districts, our 54 school districts, the Commissioner is working with on individual plans. And we're going to have to be flexible to see how this virus works. This is one of the reasons why I'm asking Alaskans now, over the next 3 weeks, to really keep your guard up, really manage this virus well on an individual and family and group basis. Because if we can keep the cases down, we keep the cases manageable, we'll still have that capacity, I think, to be able to deal with issues that come as a result of opening school. But again, this pandemic is truly, I'm not understanding, it's just truly a problem across all aspects of our society. And we've got to educate our kids. So the official position is we have to educate our kids. Ideally, it's in school. If it has to be through district plans, if it has to be shifting, certain days, certain groups go in, and online learning, we're going to all work with that. But ideally, we want them in the classroom.
And our second question comes from Aaron McGroarty at the Fairbanks Daily News Miner.
Hey, thank you. This question is for the governor. With regard to the change in the travel mandate, it's my understanding that travelers from outside the state will be required to have proof of a negative test in order to come into the state. What happens if they don't? Will people be turned away at the airport, or I guess what's the enforcement level here?
Yeah, we're going to. That's why we're also we're going to implement this in 2 weeks. We're going to work through the enforcement issues. We'll have that to report out here at a future presser as to how we're going to handle that. So we're going to start to get that word out now through Alaskans, through the press, through the airlines, that we're going to be going in that direction. We're finding that as time has gone on that more and more out-of-staters are having their tests when they come in. And so this is going to give them time, but we will talk about what enforcement approaches the state will take to make sure that those folks, if they just come in without a test, how we deal with them. And we'll report that out here at a future press conference.
And now let's go to Anchorage for our first question from Daniela Rivera at KTVA.
Thank you. Dr. Zink's presentation said, I believe, that travel is not the main driver of the recent increase in Alaska resident cases. And so I understand the change to the travel restrictions, but I'm curious if we can expect any other changes in getting a handle on our community transmission that's not impacted by travel. Thank you.
Yeah, good question. So that's a discussion that we're having with local officials. One of the reasons that we've changed the travel process coming in is we can redirect some of those resources to our internal testing, to test Alaskans, to focus on Alaskans. As the equipment and the supplies become tighter, and they probably will become a little more issues with supplies because of the numbers going up worldwide. This gives us an opportunity to make sure that we have what we need to get a handle on these case clusters that are occurring in some of our communities. But this is a discussion that I'm encouraging all Alaskans to have, all local communities to have, those along the rail belt where we see this rise in cases. We're going to have more and more discussions with folks. And again, we will do what it takes in a very an approach, again, that's not blanket, not universal, not a reaction to politics. We're really trying to look at these numbers. We're always trying to understand this data and to see how we can surgically approach dealing with these clusters. And so that's what we're going to continue to do. We feel that by tightening up on the travel coming in, it's going to help us redirect some of our supplies, but it's also going to make sure that anyone coming in, even more than we do now, is free of the virus. We don't need it. We don't need more virus being added to the mix, but we're going to continue to work with our local communities on this, and we'll ponder future advisories as well.
Okay. We have two reporters online from the Anchorage Daily News. We'll take the first of those two questions from Morgan Krakow.
Thank you. I just had a quick clarifying question and then a follow-up question. Just wanted to ask, so is the 14-day quarantine that was allowed without test results upon arrival, is that something that's still going to be allowed under this new change, or something that will not happen anymore?
Yeah, we feel it's best to just go straight to a a testing approach that requires folks coming in to have a negative. So if you come to Alaska, you should have a negative. And so that's going to be what we're going to focus on for those individuals that are not Alaskan residents and come to Alaska with a negative test. And we'll talk about, like I said, at a future press conference, what will be some of the enforcement approaches we'll take to make sure that happens.
Okay, thanks for the question.
That makes sense. And then further on that, just in terms of supply shortages in the state with regard to testing, can you talk about a little bit about how those impacted this decision into changes in travel?
Yeah, as I mentioned, I use the phrase tightening of supplies. We still have the supplies, but as we see our case numbers going up, we want to redirect the supplies that we have. We're working at continually making sure that our supplies are sufficient, but we want to redirect that to do more testing for Alaskan residents. We feel that given what we're dealing with right now in this case count that's rising, that those that want to come to Alaska, that's why we've given the 2-week window, have an opportunity to go find where they can get a test, get that arranged, have that test before they come up. Part of the planning process. And so it's really a tightening of the testing supplies. But again, it's really redeploying those resources to deal with Alaskans so that we make sure that we are testing as much as we possibly can our own residents.
And our last 2 questions from Anchorage come from KTUU. We'll take the first one from Jill Burke.
Hi, thank you. My question is for the governor. I just want to clarify again these new travel restrictions for non-residents. I guess I want to know if this is going to be on the honor system or if there will be actual enforcement at the airport, and would that be enforcement in the state or location where they're boarding, and who would do that? And then once they land and get here, who's going to be monitoring their status, and how will they validate residency, and what will happen if someone arrives here and they haven't had that test?
Yeah, as I mentioned earlier, we're working through the process. We've got this 2-week window. At future press conferences, we'll be able to roll out the details along the lines of what you were just talking about to make sure that folks coming to Alaska do follow these protocols. And so give us a little bit of time. Future press conference here in the near future, we will roll that out so Alaskans and their friends and their business partners and whoever else is coming up from the lower 48 can see what that is going to entail. Again, we will have protocols in place to deal with this, but I am appealing, as always, and will continue to, everybody's desire to not have us go through any type of severe restrictions. We don't want to do that. And so we're asking Alaskans and non-Alaskans to work with us to make sure that we don't have to get to that point. I still have a lot of faith in people for the most part, but we will have those protocols. We will roll them out, and we will present them to the press and the people of Alaska here shortly.
And up next, we have Beth Verge with KTUU.
Hi, thank you. This question is for the governor. I'm wondering, I know you talked a little bit about the local mandates and some of those restrictions that can be implemented in individual municipalities and the like. Have you further considered a statewide mask mandate or capacity limit, such as those that have been enacted here in Anchorage? And if so, what would tip you to enact either of those? And if not, why not? Thanks.
Because the vast majority of the state's communities have not been infected with the virus. That we said when we were opening the state back up and going to manage the virus, we would watch and deal with outbreaks in a surgical manner, as opposed to, and I'm making this up, there's 40 cases in community X. Well, therefore, we're going to shut the state down, or we're going to mandate across the state. Because in conversations I've had with folks across the state, again, some of them have never seen the virus. Some of them are being pretty diligent when it comes to making sure that they are restricting non-essential travel. They want to make sure that if they don't have the virus, they can carry on life as normal as possible. And so, again, you see, if you look at the lower 48 and how they deal with the virus, there are counties that put restrictions in or protocols before the state does. There are cities that do that. And so we just think it's just a better approach surgically that this occurs this way. For example, in Southeast Alaska, a week and a half ago, again, as I mentioned at a previous press conference, there were a number of city governments, mayors, assemblies, mayors, council folks, that their city councils that debated these issues, for example, on masks. And some of the cities voted to implement a mask mandate. Some of the cities voted not to. They're looking at their cases. They're looking at their situations there on an individual basis, which I think we should. I've been implored by folks to do a statewide mask mandate. I've been implored by folks not to let it happen at the local level where there is an issue. And if there's no issue in another locale, another community, the question is, why would you do a statewide mandate? And so, again, it's not an issue of taking decisive action. I think, if anything, February, March showed that we would, especially under the scenarios that were laid out. But now we understand this virus a little bit better. We believe it's best approached in a surgical manner. We are willing to work with any and all communities. Our health team is ready and does work with any and all communities in the state of Alaska. We are taking and still have approaches in place on a statewide basis with regard to industry protocols. I just mentioned a couple minutes ago what I'm going to do as a governor with the state of Alaska in terms of travel coming into the state of Alaska. But it's a mix that's really going to give us the results that we want. I know that it will make a lot of people happy if we have no advisories, no approaches to mitigation, because there's a lot of people that believe that it should be done on an individual basis, individuals. I know there's a lot of people that would love for me to mandate masks, bar closures, restaurant closures, but it just simply doesn't make sense when you have communities that have never seen the virus and may never see the virus. And so again, it's a surgical approach. That way we can deploy resources if we need to, like we talked about with the airport testing, to places that have a growing case count. And we can devote staff and personnel to that. You do a statewide mask mandate and you get a call from small community X saying, we don't have a police force and our people aren't wearing a mask. And by the way, we've never had a case. Why are we wearing a mask? It just makes more sense from a resource perspective, from a focus perspective, and really from a local control perspective, to have a partnership with the state, with the local elected officials and the local folks to be able to battle this virus.
Okay, let's go to Juneau, and we'll take the first question from Peter Siegel at the Juneau Empire.
Thanks. This is a question for the governor. Some health experts have expressed to me that a mask mandate could be powerful symbolically and send a strong message about wearing masks. And today, some of the state health experts said that part of the recent rise in cases could be attributed to young people who may be less likely to follow healthcare precautions. So if not a mandate, is there something that the state can do to really step up the messaging that wearing a mask in a lot of situations is something that a lot of health experts are recommending be done?
Yeah, that's why we talk about it here at the press conferences. That's why you're going to see more and more messaging on that from the state of Alaska. Again, it comes down to, it's a very good question, Peter. It comes down to, when you're a child and you sneeze, people tell you to cover your face with your hand or your elbow or your jacket. It doesn't necessarily prevent you from spreading something, but it helps minimize it. I mentioned a week or two ago that the flu vaccine, it's over 300 million people in the country. And the flu vaccine is really only 20 to 50% effective. And tens of millions get it, not necessarily hundreds of millions, not the whole country. And so people may wonder, well, then how does it work? Just by that small number taking action. And remember, a flu vaccine is not necessarily mandated for people, but that small action taken by a number of people keeps the flu death rates within the 30 to 60,000 range per year. Again, we did really well early on when we all believed what was going to happen to Alaska bordered on catastrophic. The death scenario that was laid out, fortunately, never materialized. But we still have a problem, and I believe it's going to be best addressed by individuals saying to themselves and their friends, hey, wear a mask. Do you have your mask with you? Bring your mask with you. We're going to go in a store, wear the mask. And I'm seeing that more and more and more, to be perfectly honest with you. And I'm hearing that more and more and more. And so I think that's the approach we take right now. Some cities, for example, as Juneau, have mandated a mask. I will support what they do at the local level. But we are going to step up the messaging. We do believe, like a hand in front of your face, a mask can help mitigate. And we support that. I support that 100%. It's just the issue of mask mandates statewide, hundreds of communities that have never seen the virus. That doesn't make sense, but we're going to continue to message it.
And we have one more question from Juneau, this time from Andrew Kitcheman at public radio station KTOO.
Thank you, Jeff. I have a question for the governor. Governor, House members said today they're hearing concerns from municipal government officials. They will face legal challenges for imposing COVID restrictions. It's a two-part question. One part is, what assurance can you offer that municipal actions would withstand legal challenges? And will the state help with enforcement?
So I'm not sure exactly what legal challenges they're referencing. This pandemic has presented, I think, many opportunities potentially for legal challenges, unfortunately. We do have Ed Sniffen online. Ed, is this something, did you understand the question, and is this something you want to address at a certain level? Or can address, I should say? Please.
Yes, thank you, Governor. And yes, I did hear the question. And I think you're right. I mean, the legal assurances that, we can give are, really just helping municipalities navigate through the legal landscape to ensure they have the authority to do what they've done. And we've been working with municipalities and local governments to weave through that. Nobody's ever immune from a lawsuit. People sue people all the time for whatever. All we can do is make sure that we have the best legal authority that we can help municipalities understand before they decide to take action. And we've been trying to be proactive in doing that with communities.
Okay, thanks, Ed. Let's wrap things up tonight. We've got two remaining questions. We'll take the first of those two from Margie Bauman at the Cordova Times.
Yes, thank you. I hope you can hear me, Jeff.
Yes, we can. Go ahead.
Hello?
Go ahead, Margie.
My question for the governor or Commissioner Crum, kind of two-part. Have you found any common denominators for these clusters of positive cases in seafood processing plants? And then my second part is Trident Seafoods has been bringing in people whom they have tested before they allow them to get on a plane to Alaska, and then quarantining them for 14 days in Anchorage before sending them out to rural processing facilities. Is this something the state is considering as a mandate for all the processors? Thank you.
Yeah, it's a good question. And Adam, let me just hit it at a 30,000-foot level. So the processes that we're seeing having an outbreak are resident right now are resident processing facilities. The folks have done a pretty good job in the seafood industry and the processing industry in testing their folks and quarantining their folks, and we really don't see a lot of spread from those processing operations into our coastal communities. But again, this is something we're keeping an eye on. We're trying to dissect, understand it. Trying to get ahead of it as much as possible. Like I said, sometimes these clusters, when they occur, we're following up. We're doing an investigation as to why it happened. But Adam, if you want to take it down to 10,000 feet and just add some detail to that, that'd be great.
Thank you, sir. As the governor said, last week we looked at these ongoing cases that we had from fish processors. We wanted to make sure what we were finding. And so we're not prepared to release it today. We're going to finalize some of this. We're working with our industry partners. We put forward some different testing and quarantine protocols working with these groups. And it's kind of, there's closed facilities, there's open facilities. It depends on where they're at and kind of are there people interacting with the public or are they staying on campus, and just trying to give a little bit more guidance on how we can move forward with that. And so this is something that we've been paying attention to, and we think that, as the rest of the fishing season is going to go in specific places around the state of Alaska, that we have an opportunity to just curtail this and keep these little surges contained so it doesn't affect community spread.
Yeah, and so Margie, as was alluded by the commissioner, we're working on some revisions to some of these processes regarding the processors, and we'll have that discussion with the people of Alaska here in short order.
And our last question for the night comes from Brian Mazurik at the Peninsula Clarion.
Hi, thanks. My question is probably for Dr. Zink. I'm curious, it's tied with everything that we saw with the seafood processing plants last week. Do you see that as a potential warning sign for what could happen when school starts in the fall, considering that it's kind of a similar congregate setting situation?
Yeah, I appreciate that question. I mean, we do think about congregate settings as a higher risk place, but I think that the reality of what happens in a seafood processing plant is quite different from schools. I also think that we need to look at the age distribution. So we are starting to see some data that children under the age of 10 are less likely to transmit the virus than people who are older. And so that's an important factor to take into consideration as well. The seafood processing world, as Margie had just commented on, did a lot of work to kind of quarantine and isolate people who were initially coming into the communities, because we knew it would be so hard to be mitigating the risk once they were working in close contact. We saw that with the meat processing plants in many other states beforehand, and really tried to do everything we could to minimize it. But unfortunately, when you just work in such close quarters where your shoulders for 12, 14 hours a day doing seafood processing, it becomes very challenging to mitigate the disease. Again, I think that's different than schools. I think what we see in the seafood processing, meat processing is different than what we're seeing in school outbreaks, and there's different ways we can mitigate it. That being said, they're both complex. There's a lot of variables, and we have a whole team stood up to help support schools in a very similar way that we had a team and continue to support the seafood industry to minimize the outbreaks associated with that. I'm grateful we didn't have any large outbreaks until now. I wish we still didn't have the ones that we did, but really appreciate the partnership with the industries as well as the communities to try to mitigate these outbreaks as quickly as possible.
So thanks, Doctor. And so, again, we implore Alaskans to help us, to help all of us. Again, and this is not to guilt anyone, but you got to keep things in perspective. As many of us are trying to live our lives exactly the way we did before the pandemic, others can't. We have folks in the pioneer homes. We have folks that are seniors. Some of them have not been able to embrace their loved ones for months. That's because they're in a high-risk category. We've done a very good job of keeping that virus out of those environments. We still have a very low death count compared to other locales. You see, as I mentioned, it's going up. The cases are going up throughout the world. It's a situation where people are putting the brakes on, letting the brakes off, trying to figure out if there's a sweet spot in how to deal with this virus until the vaccination comes. In the state of Alaska, I have a lot of faith in people. I've said this over and over again. We demonstrated that back in February, March, and April. And then we opened up the economy because what was happening to us was just as devastating. I said that was the flip side of the pandemic coin. There's the health side, there was the economic devastation, and how it impacted our society as a whole. We need us all to work together to come up with that sweet spot in the middle ground, and we can do that. I really believe we can do that. When you leave a house, please take a mask with you. I don't like a mask. They don't look good. I don't like wearing one. I'm not sure of too many people that really do. But nonetheless, it's a tool that's going to help you if you find yourself in a situation where there's others, where you have to be in close proximity. Because, again, it may not necessarily be about you. It may be about that individual whose immune system is compromised because they're undergoing cancer treatment. It may be about that individual that has to go home and take care of elderly parents that already have a compromised health situation. It's really about that. It's really about helping those guys. I believe there are real attempts by some to politicize this event nationally, politicize this situation potentially here in the state. Again, I'd like to think Alaska is a cut above other states. Many of us came from other states. Many of us were born here. This is a special place. I don't think it's going to take a lot for us, just some small changes in our daily lives. Bring a mask with you. Do your work online if you can. Shop once a week if you can. You're invited over to a house party. Ask the question, is it going to be outside? Can it be outside? Can we be distanced? You see a friend you haven't seen in a while. Do you give them a hug where they say, don't worry about it, we don't have the virus? We don't know if you have the virus. It's easily spread. Again, the vast majority of people won't even know they have it. Vast majority of people aren't going to necessarily be sick. But those that are in those categories, it's a real problem. We got a vaccination on the horizon that shows a lot of promise. I mentioned to you when this pandemic started that we're going to give you as many of the facts as we can, the data that we can, the stuff that we know, that we're not going to hide anything. I think we've done a pretty good job. I think our team has done an excellent job, and Alaskans have done a job. This is a big family in Alaska. So I'm asking Alaskans for the next 3 weeks to do our best. Carry a mask with you. Avoid folks if you can. Minimize your contact if you can go and do things online. Do things outdoors. If there's a funeral, if there's a wedding, if you can have it outdoors, that's going to help. If you are contemplating a big get-together, we're probably going to have discussions with you here shortly in terms of large get-togethers as well, how that's going to actually be run. Because house parties, large get-togethers, some of the activities where you're elbow to elbow with somebody, this is a problem. Our healthcare capacity right now, our hospitalization capacity is still pretty good. We still have a lot of good numbers. It's just that they're trending upwards. We just want to get ahead of it a little bit. We're asking for your help, Alaskans. And again, I'm honored to be the governor of Alaska because this is an amazing state with amazing people. If we just work together over the next 3 weeks, I think we get ahead of this virus and we show the world, once again, show this country, show the world that when Alaskans put their mind to something, we'll get through it. So with that, I want to thank you, and we will be notifying you on revisions and changes in any advisories and protocols pretty quick through press releases and press conferences that we're going to have in the very near future. So thank you.
Okay, again, that was yesterday's press conference with the governor and crew and reporters. And the main takeaways, again, a question that has come up a lot, actually, the one having to do with local communities being able to exert tighter controls when it's deemed necessary. That's been sort of an evolving position from the state, where early on the governor and the administration seemed to want to keep things pretty uniform when this was all new. But, of course, they've learned over time that there is wisdom in not treating the whole state with a broad brush, something that I think we kind of knew here and had an instinct for all along. But this state's a larger operation and with a lot of different influences, and it just, they takes them a while to catch up sometimes. I mean, it's sort of like what's happened with the processing. Our processors had a pretty good idea of how to keep a handle on things before the state had even come up with any plan to really address the fishing industry at all. And the city of Cordova, our IMT and our processors had influence in the conversations that eventually shaped the state policy. So, again, it's sounding like they are, at the state level, are recognizing the wisdom of not trying to make everybody in the state behave a certain way just because there's a particular problem in Anchorage or Fairbanks or Juneau or something like that, but to recognize that some communities can be a little freer while, some may need to tighten things up. Surprising to me personally in a way that it's taken them that long to sort of officially reach that position, but there it is anyway. And then the other thing, too, as I'm sure you heard if you listened to the whole thing, is some changes to the travel for out-of-state people, for non-residents. When testing supplies were more plentiful, there was a desire to go ahead and be able to provide tests for out-of-state folks that didn't have a negative test in hand so they could continue to enjoy the state safely up here. But with our rising case counts internally now, with our own Alaska community spread, they want to protect those supplies. And so If you have anybody from out of state planning to come up for a fall visit, or any of you that have out-of-state sports fishermen that are coming up and staying at a facility or whatever, be sure that they know that this is coming. I mean, that's something that we have always advocated from the get-go, way, way, way back when we were talking about whether there was going to be a fishery or not, is that one of the most powerful things we can do as individuals and families is communicate with the people in our network. Whether, if you're running a fishing lodge and you've got clients coming in, obviously it's wise to reach out to them and tell them about this requirement now that's coming starting August 11th to have a negative test in hand. Or, back when it was being sure that all your friends who fish knew what the requirements were for getting, what were those called? The mutual understanding agreements or whatever. Mutual aid agreements with the city. Those things you can download. So keeping each other informed continues to be the best approach. We're still doing well, by the way. We have one active resident case and one active non-resident case. Hopefully that will continue to stay in that range as long as we continue to do the things that we heard suggested at the state level and also have repeatedly been brought up at the local level. Masking if you can't stay away from other folks. Staying away from other folks as much as possible. If you want to follow my mental model, just assume anybody that is not living in your household has it. And don't hate on them for that. Just treat it as a fact. This person may have it. I can still wave, but I'm going to stay more than 6 feet away from them. I'm not going to say, you might have it, so get out of this store. I mean, there are crazy people in the lower 48 doing that kind of thing. I hate to have to even bring it up, but, we found it to be a really good strategy. And we'll close on something that Dr. Sanders brought up again with regard to how you mentally make the decision to use these safety precautions. Because, there are going to be some who will continue to think, this is overblown, I don't need to do this. The situation I would hate to see anybody in, and it has happened, is to be in that position where you think, this is not a big deal, I don't need to protect myself, I don't need to protect other people, and then lo and behold, you get sick or you make somebody else sick, and you have to live with that for the rest of your life. There was a case, not in Alaska, it was a lower 48 case, but I saw a write-up on it where a young girl, a 20-year-old, went to one of these house parties. No mask, no social distancing. We're invincible, we're young, we don't care. Caught it, brought it home to her grandparents. And the granddaughter, the grandmother, and grandfather all had to go on ventilators. And the grandfather didn't survive. So she basically, through that behavior, she basically took her grandfather's life. I mean, that's an on-the-nose way to put it, I know that, but really, when you think about it, that's sort of what it boils down to. She survived. She was the one who brought it into the household. Grandfather died, and now she's got to live with that for the rest of her life. I would not want to be in that situation, which is a big part of why wearing a mask doesn't bother me. And again, that's not to discount the people who can't wear them because of medical reasons. But those of us that can and just don't like it, I mean, what we're throwing out there is to consider that possibility, that outcome of what would it be like to be the person responsible for harming someone else, or by harming yourself, causing distress to your family. So I hope we'll continue to be smart. I hope we'll be able to continue to keep our numbers low. We thank you for listening to the town meeting program and making it through this rather long marathon edition of the show, brought to you by Cordova Wireless Communications. We'll see you for the daily briefings a little bit later, 1 p.m., 5 p.m., and 8 p.m. This show and the daily briefings go on to our YouTube channel, youtube.com/Cordova TV. Again, be safe, and we'll get all of your preempted programming lined up and ready to go for you here on KLAM.